All right, everybody, welcome back. So the pandemic 15 is more like the pandemic 30 or more, and the CDC is now sounding the alarm on the country's growing problem of obesity. Joining me now to talk about the CDC study is Dr. Andrea Schwerer, a bariatric surgeon at SSM Health DePaul Hospital. Good morning to you. Thank you so much for joining us.
Good morning.
Okay, so Missouri is one of the states that is on the top of the list for obesity. So tell me a little bit about how you guys have seen this problem increase.
Yeah, actually, of all the states, Missouri is growing in obesity, but it's not at the top yet, which is actually very encouraging. So 16 states have made it above a BMI of 35, which is class 2 obesity. We haven't seen that in the last 10 years. And so, luckily, Missouri's not there yet. I think it's happening, which is, unfortunate, but there's things we need to do to kind of address it. But we've definitely seen an increase in weight.
Okay, and so how has the pandemic seemed to affect that? A lot of us have been, sitting around and not on our daily routines, not moving as much. What have you guys seen with that?
We've seen that as well. Unfortunately, a lot of people lost their jobs. If they didn't lose their jobs, they're working from home. They're going out less. They're being less active, and all that takes, a lot of effect on your body. If you're not getting out of bed into your car and going to work, you're not having those extra steps. And so those little changes throughout the day add up over time, and people are adding weight. I think the study showed that people on average gained about 30 pounds over the last year. That's a lot.
Yeah, that's more than the freshman 15 we usually hear about. So we're hearing more about how it's not necessarily the number of calories we eat, but what we are eating. What is your take on this?
I think it's both. Okay. I think it can, there's definitely importances in reducing carbohydrates, having a lower fat diet, increasing protein, that's important. But calories also do matter. If you are eating or consuming a lot of calories over the amount that you should, you are going to gain weight. So I think it's both. I think we need to look overall. If you're have health diseases or health issues, lowering certain components of the diet are important.
Okay, and you are a bariatric surgeon. Tell me what you all are able to do to help and also help those addicted to certain ingredients like sugars, artificial sweeteners, salts, or processed foods.
Sure, and that's becoming more and more prevalent. We see that where there's so much sugar in all processed foods, and if a lot of people don't have time to make healthy meals, especially with the pandemic. We're more stressed, we have more things on our plate, and so people go get processed, pre-made foods, and so that addiction is becoming more and more real. What we do is we have a non-surgical and surgical program for people who struggle with their weight. So if you are interested in surgery to help weight loss or non-surgery, we can offer those techniques.
Okay, so just come in maybe for a consultation with you all.
Correct.
Nothing to be nervous about?
No, nothing to be nervous. The first time you meet us, we're just going to talk.
Okay.
It's, there's nothing scary about it. Nothing happens really the first day. It's really an introduction. We get to know you, know what is bothering you, what you struggle with, and what we can do to help. And so, yeah, it's nothing to be scary about. The best thing to do is to start a conversation.
Awesome. Thank you so much for joining us this morning. Yeah. If you guys would like to hear more information or hear this interview again, you can just visit our website, fox2now.com. We'll be right back after the break.